Now to Nigeria, the country has expressed anger at a decision by the UK to introduce new travel restrictions in the face of the Omicron coronavirus variant. It's joined 10 southern African countries on the UK travel red list, temporarily banning non-nationals or residents from entering Britain. While speaking to the BBC, the Nigerian High Commissioner to London said that the restrictions were a form of travel apartheid.
We align ourselves with the position of the UN Secretary General, and he has classified the selective ban as travel apartheid because we are not dealing with an endemic. If we are dealing with an endemic that is related to selected countries, that would be understandable. We are dealing with a pandemic, and this is the fourth variant. Moreover, this variant was discovered in South Africa as a mild variant. No hospitalization, no death. And what we will have expected other countries of the world to do is to join in scientific investigation of the potency and all issues relating to this Omicron.
So the Nigerian High Commissioner to London there, not mincing his words, describing the travel restrictions as a form of travel apartheid, adding Nigeria, of course, to the UK's red list is just one of the measures being introduced by the UK. Pre-departure COVID tests will also be brought back. So let's talk through some of these measures with Professor Mark Woolhouse, one of the UK government's scientific advisors. But Professor, you are joining us in a personal capacity. Let's start with the travel bans. When it comes to imported cases, how does that compare to community transmitted Omicron cases of this variant? What should we be looking at? Is there any point to having travel bans now?
Well, the travel ban has the effect of delaying but not preventing the arrival of any new variant. That's a well-established epidemiological principle. The World Health Organization is very clear on that in its guidance that travel bans can delay but not prevent. And our experience tells us the same thing. When the Delta variant first emerged, which we believe was on the Indian subcontinent, that spread right round the world, pretty much regardless of what any country's policy on travel bans or travel restrictions was. It was a very infectious variant. It rapidly spread to many, many countries. We believe Omicron is even more infectious than Delta. And certainly the early evidence is that it will spread around the world even faster. So travel bans are never going to be the solution to this whenever they're implemented.
So if travel bans are not a solution, one of the other measures that the UK is introducing are pre-COVID departure tests, the reintroduction of PCR tests. You've described that as potentially closing the stable door after the horse has bolted. Is it not a good idea, though, to have these pre-departure tests?
No, I quite clearly said that I was very supportive of the testing. So what I think we have to move to right across the world as we accept as a world that we are living with COVID, not trying to get back to a state before we had this disease. When we're living with COVID, we have to accept that we're going to have to make our activities safe. We can't take this strategy anywhere of banning them completely and letting it go with that. So the way we make travel safe is by testing. And that's the way that we make many activities safe. Here in the UK, for example, the advice is that before you do any activity that involves contact with other people, that you take a test. And I think that principle can definitely be applied to travel. And that's probably the most sustainable way forward we can for travelling in a world that has COVID in it.
Given the transmissibility of this particular variant, just how transmissible it is compared to, say, Delta and the previous variants that we've had, the Deputy Prime Minister, Dominic Raab, said that there would be criticism about the UK, amongst other countries, going too slowly in terms of its response to this particular variant as being a kind, in his words, the Goldilocks criticism, as doing a little bit too, not done enough, too little of this, too little of that. What's your reaction? Should the UK have gone in stronger even sooner? Because the Prime Minister is saying that they went in very early with restrictions.
So I do understand the UK government's position on this. They got a lot of criticism when Delta first arose for not closing the border to India more quickly, even though they actually did so before the World Health Organization Organization recognized Delta as a variant of concern. So they acted quite fast then, but it didn't make any difference. We still got Delta in the UK, and it rose very fast, and we've had a significant Delta wave, and they're now experiencing a Delta wave in the rest of Europe as well. So again, it's this business that you can maybe delay the arrival of a variant, but not prevent it. And the question is whether this policy of putting travel bans in particular, and as I've emphasized before, I fully agree with the testing policy, but whether putting travel bans in place every time a new variant arrives is a sustainable way of the world living with COVID. And many people would argue that it's not.
So when it comes to South Africa, where this variant, this latest variant was first discovered, they're saying that potentially the rest of the world is overreacting, that yes, it is a transmissible variant, but it could possibly be milder. When will we get the kind of definitive answers to whether the Omicron variant is indeed milder, that perhaps we are not as at risk from it? What's the reading that we should take into this?
Well, we're going to get that from the clinical data as more people become infected with Omicron, and we'll find out whether they end up in hospital and whether they get severely ill, and also other important information, sort of whether the same risk factors, which is age and comorbidities, apply to Omicron as they did with Delta, and also what the impact of people's vaccination status is on whether they get infected and whether they get disease. But all of this information will take some weeks to acquire. The UK government's working on the basis that it should be about 2 more weeks before we have that kind of data. And then we can plug that into our risk calculations. The difficulty is, of course, if you find out you do need to do something, you needed to have done something very early. But the obvious issue for the UK is not the travel cases anymore, but the fact that we do have community spread here. So if we think we need to slow the spread of coronavirus in the UK, we're going to have to do that by slowing community transmission. And that brings us back to one of the suggestions I made earlier, which is actually that testing regularly is one way to make sure that people who are infected and infectious are not putting others at risk. The other thing we do, which of course is very important for all countries, is to roll out our vaccination programs as fast as possible. And although there are some concerns that the vaccine won't be as protective against Omicron as they are against Delta, there's lots of good reason to expect that they will be still significantly protective. So that's another thing that countries can be doing as rapidly as possible in order to protect themselves from a very fast spreading variant.
So many questions. Thank you so much for your time. Professor Mark Woolhouse, who speaking to us in a personal capacity, but advising the UK government on this. Thank you very much for talking us through it.